Hello, I'm Nadim Aslam. I'm a consultant orthopaedic surgeon specializing in knee injuries, knee and hip replacement surgery. I'm the leading robotic surgeon in the United Kingdom. I'd like to talk about the benefits and the risks for knee replacement surgery. The benefits for knee replacement surgery are an improvement in pain, an improvement in the function of the knee, the movement, and the ability to carry out everyday activities. However, all operations do have risks. These risks are reduced with robotic surgery, but they are nonetheless present. The risks of surgery are one, infection. Infection risk is 1 in 100. This is a serious problem which can lead to washout of the joint, and in some occasions the joint has to be removed, and it can involve 2 to 3 months of further treatment and then putting the joint back in. Knee replacement surgery has a risk of thrombosis, which is blood clots in the veins. We reduce this risk by giving Clexane, early mobilization, and stockings. Next, patients have a risk of stiffness and scarring, which sometimes, in around 1 to 5% of people, may require manipulation. Next, knee replacement surgeries have a risk of injury to the nerve and the blood vessel. Although this is extremely rare complication, less than 1% is a very serious complication, and it requires transfer to the local hospital for emergency surgery to evaluate the nerve and/or repair the blood vessel. Next, dislocation of the knee is very rare. Next, patients can have ongoing pain. In a knee replacement, there is an 80% satisfaction rate. So 10 to 15% of patients can have ongoing pain. There is a risk in some patients that the implant will fail early and the patient may require revision surgery. The majority of patients will do well, and it's important that any of these risks are picked up early so we can deal with them and give patients the best possible recovery and effective care. Thank you.